Greetings. Thanks for joining today's webinar, The A to Z on Allergies. I'd like to introduce myself. My name is Lisa Holland. I'm the president of the Stay Fit Plan, a corporate health and wellness company. I'm also a registered nurse by education, and I have over 25 years in the health promotion field. I use my personal passion to help people lead a healthy, wealthy, and optimal way of life. Today we're going to talk about allergies. Most of us have them and suffer from some form of allergic reaction, whether it's seasonal allergies or annual allergies. So I want to take some time to cover a lot of information today. This presentation is unlike some of our other health and well-being presentations because a lot of times there's not much we can do in terms of prevention other than avoidance. And we're going to talk about some self-care issues to help you with dealing with allergies. What is allergies anyway? Well, it's a condition caused by hypersensitivity of your immune system to something in the environment that usually causes little to no problems in most people. But for those of us who suffer from allergies, it can mean a variety of things. It can mean a runny nose, it can mean itchy eyes, it can mean a severe allergic reaction, and almost, sadly, death. We're going to cover as much as we can today on a variety of different topics, common allergies, some food allergies, and look at how those allergies can affect us and how we can do some things to protect us. I always like to mention that today's presentation is educational, hoping to provide you with information that you may already know and enhance that education and knowledge that you have. Please work with a physician as always. They are your primary care provider. And if you do have allergies, anything that we talk about today and you'd like to try, please run that by your primary care physician. So we're going to talk a little bit about the reaction to allergens, get a little technical, not too bad. We're going to talk about signs and symptoms, the diagnosis of allergies, and how you can determine if your allergy is truly an allergy or maybe it's the common cold. We'll explore some of those self-care treatment options that we talked about, look at the cost and cost savings of some types of treatments, and then we'll give you some information on how to build an allergy relief kit that you can use for home or work or even in your car. Oh, you know what? It's that time of year. Achoo! 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 Just kidding. But spring is coming and that seasonal allergy itchy eyes, runny nose could be just around the corner. This picture, I think, represents how most people feel during allergy season. Their immune systems are working hard to react to these harmless substances that enter into their system that just cause havoc from not being so harmless. Allergens can stimulate your immune response when you're breathing or touching something, or even by the ingestion of food or beverages, sometimes even from injections of medications and bug bites. For our little guy here, the flower or the pollen that he's sniffing is the allergen. And for those of you who love gardening or spending some time outside, you know that those pollen counts can really wreak havoc and really cause not to feel so great. And once those allergens hit, it's like, boom, you're really being knocked out. And you can feel just like this guy. As this cartoon depicts, allergic reactions feel like a big boom. The severity of that allergic reaction can vary from mild discomfort to life-threatening situations. Each year, about 200,000 people visit the emergency room because of allergies, and almost 10,000 of those people stay in the hospital each year because of food allergies. Anaphylaxis is a life-threatening reaction to allergens, and it's the most common triggers for anaphylaxis include medications, foods, and insect bites. About 17.6 million adults suffer from rhinitis allergic reactions, otherwise known as hay fever. The symptoms include, as I mentioned, that runny nose, blocked sinuses, sometimes a headache from the pressure and the congestion. And well, they just make you feel crappy. So what really goes on in the body? This picture shows a really technical side of that allergic reaction. So I'd like to explain it a little bit at a time. From a biological perspective, your body starts to produce a specific type of antibody called IgE. And these bind to the allergen, the things that make you allergic. The antibodies then attach to the form of a blood cell called a mast cell. These mast cells can be found in your airways and in your intestinal tract. They can also be found in your skin cells. The presence of mast cells in the airways and the GI tract and other areas are what make you more susceptible to allergen exposure. Once an allergen interacts with you, it binds to that IgE antibody, and then it is attached to the mast cell. This causes the mast cell to release a chemical called, drumroll please, histamine, the main chemical caused by most allergic reactions. And hopefully this has triggered something in your mind right now about some of the over-the-counter medications that are available. Hint, hint, antihistamines. Okay, so how does your body defend itself from these allergens? In most cases, an allergic reaction is a host of symptoms that happens to your body when it comes into contact with a specific allergen. And we're all different, right? So each person will have a different reaction to an allergen dependent upon a variety of different factors. One of those factors is, what does your body determine is the allergen? Are you allergic to pollen? Are you allergic to some specific foods, a bee sting, medication? How is the allergen entering your body? Are you inhaling it through your breathing? Are you eating it and ingesting it into your gut? Is it something with contact, like a contact dermatitis? And then lastly, could it be caused by an injection, such as some medication that you're taking? The other thing that's going to depend on your allergic reaction is the concentration of the allergen. So how much are you breathing in? During seasonal allergies, when there's a lot of pollen in the air, and if you go out on a high pollen count day, you could suffer a higher level of reaction than you did on perhaps a non-seasonal allergy part of the year. And what happens and what is the degree into which your body is reacting? What is your threshold for that particular allergen? Some people can stand pollen and not have anything happen to them. Others, a small amount of pollen will just set them into a tizzy and they'll have a severe allergic response. Childhood allergies are continuing to rise. And it is now estimated that nearly 6 million, or 8% of children, have some form of food allergies. And in addition to kids and us as adults, we're not alone. Even poor Fido here can suffer from allergies. Your dog or cat may in fact suffer from seasonal food allergies. Yep, it's true. I'm not kidding. Unlike humans, whose most allergies are respiratory allergies, dogs and cats often take this form of skin irritation or inflammation, generally caused by foods. We won't cover pet allergies today for you pet lovers out there, but you can speak to your vet to find out more information about your pet and if they're suffering from certain types of allergies. So let's move away from pets and let's look at toucan, because as the saying goes, follow the nose because toucan knows. The most common form of allergies today is allergic rhinitis. And for those people who suffer from allergic rhinitis, the name indicates exactly what it is. It's symptoms that primarily affect the nose. You'll feel a lot of sneezing, itchy nose, runny eyes. These are certainly annoying symptoms. And over 40 to 60 million Americans are affected by this. There are two types of allergic rhinitis. There's outdoor or seasonal allergies, commonly known as like hay fever season or ragweed pollen. Seasonal allergies occur in the spring, summer, and early fall. They're usually caused by allergic sensitivity to airborne allergens such as mold spores, pollen, grass, trees, and weeds. The second type of allergic rhinitis is indoor or perennial allergy or allergic rhinitis. As this name indicates, it's a year-round allergy and generally caused by dust mites, pet dander, cockroaches, and mold spores. Many people have more than one type of allergy, so you may have both seasonal allergies as well as those annoying indoor perennial allergies. And for those who have both, my heart goes out to you. So, what are the symptoms of allergic rhinitis? Well, it's sneezing, it's nasal congestion, that sinus pressure that causes sometimes headaches, the runny, itchy nose, the watery eyes, the scratchy throat, sometimes a cough. And usually that cough is brought on by the nasal congestion or the postnasal drip that you're feeling. And then sometimes you get swollen eyes. But is it allergic rhinitis or is it the common cold? And how do you know? Well, let me just give you a little quick hint. Generally speaking, the symptoms you see here are allergic rhinitis. If you have a common cold, generally speaking, these symptoms, along with body aches, a fever, and general feeling of malaise, indicate the common cold. So we know that there are definitely things you can do for the common cold and things that you can do for an allergic rhinitis. It's just determining which one you have so that you can appropriately self-treat it effectively and have some relief. So what's making us sneeze? What exactly is it that's making us sneeze? Well, to truly determine what your allergies are, it really does take a medical professional to diagnose you. That physician is going to give you a complete medical history. You're going to get a physical exam, and then in most cases, that exam is also going to include certain testing for different types of allergens. Now, there's a couple of primary tests that a physician will run to determine those allergens. One is called a skin test, and many of you may be aware of it. It can either be done through a skin prick or more commonly known as a scratch test. This is when the surface of the skin is pricked or scratched and a drop of the suspected allergen is placed on your skin. Now, this can be uncomfortable for some people, and the reactions generally show up within 20 minutes, and the physician does certain measurements based on the type of allergen and the type of reaction seen on the dermis or your skin. They also can use intradermal injections of allergen, which are a little bit more intense, and this is a little bit more of the allergen placed under the skin instead of scratched, so it's deeper allergy testing. Now again, this usually produces a response in about 20 minutes, and both of these procedures are generally pain-free. Now, however, if your physician is suspecting a more severe allergic reaction, he or she is probably going to order a blood test. And this type of testing, as I mentioned, is done when a skin test cannot be performed, especially if you already have like an eczema, which would be very, very uncomfortable for a skin or a scratch test. Blood testing will test for a specific IgE antibody. Remember the mast cells and the IgE antibody slide that we saw just a little bit ago? This will look for that specific IgE antibody and determine what exactly you're allergic to. The blood testing results do take a little bit longer, so you might have to wait a week or two before you actually find out what those results are. Now, I know this is going to sound pretty self-explanatory, but let's review this again in terms of what you can do from a self-care perspective for the treatment of allergic rhinitis. So the first thing that you can do, obviously, is avoid the allergen altogether. And of course, that's easier said than done, especially if you love to be outdoors and you want to enjoy the great weather both in the spring and in the fall. The next couple of slides, we're going to go into some of the other types of self-care, such as the medications, some nasal spray, and some alternative therapies as well. So, for example, antihistamines or over-the-counter medications are readily available. They come in a variety of different forms, such as pills, liquids, nasal sprays, and eye drops. Antihistamines work by blocking the histamine released by those mast cells and keeping it from binding to the receptors in the blood cells, which cause redness, swelling, itching, and changes in secretions. You can also get a decongestant, and that's going to help with that nasal filling and the swelling that goes on there. Decongestants are sometimes prescribed with the antihistamine. The decongestant is exactly that. It shrinks the inflammation in the nasal tissues so that you can breathe better. And these medications sometimes also come in combination with an antihistamine, so you only have to take one medication. And an example of that would be a Claritin D or a Tylenol and allergy and sinus, which is an all-in-one medication. And I couldn't help myself because I thought this was the cutest thing, but this little kitty asks, will an antihistamine stop the scratching? So I just thought that was really cute and kind of a nice little sidebar. So some other types of medical interventions that can be used for treatment of allergic rhinitis are steroids. Known medically as corticosteroids, these can reduce inflammation associated with certain allergies. Now, systemic steroids are available as well in pill or liquid form. They're also available in the nasal spray and even eye drops. Steroids are highly effective, and they must be taken regularly and in a very, very prescribed dosage fashion. You must have a prescription and you must speak with your doctor when you're using steroids. Steroids can also have short and long-term side effects, so you want to make sure that if you are prescribed this medication that you're taking it as prescribed by your physician. And again, I can't stress this enough. There's a lot of side effects with steroids, so please be careful if you are using this methodology. The other type of medication that can be used is bronchodilators. These are mast cell stabilizers, and they're used to treat inflammation mostly in bronchial tubes. So if you have severe allergies that are causing spasms within your lungs, bronchodilators will be prescribed for you. Again, these are prescribed by your physician, and they should only be used in conjunction with any other treatment that a physician has prescribed for you. There are allergy shots that also can be used in conjunction with medical prescriptions for your treatment. These usually are not provided unless you have been suffering for allergies for more than 3 months. Basically, the way these shots work is that you're gradually exposed to increasing levels of allergens to help your immune system build up a tolerance to those allergens so that your reaction and your allergy is not as severe. This is not going to get rid of your allergic responses. It will lessen the severity. Let's look at nasal care and aromatherapy. Now you can see here one of the nasal care for allergic rhinitis is a neti pot. And I don't know about any of you out there, but I have been prescribed this particular alternative method. I just never got the hang of it. I found it quite uncomfortable. You are flushing water through your nasal cavity, and if you're not doing it correctly and your head is not postured correctly, you can actually inhale a little bit of water or swallow some water, and it's just, for me personally, was not a good feeling. However, I have some friends of mine who actually swear by the neti pot. They have chronic perennial allergic rhinitis, and they use it all the time, and they said it eliminates and almost eliminates a lot of their symptoms. So basically, it has been shown to be an effective way to remove irritants from the sinus cavity. This is done by a warm salt water mix. And you want to make sure that when you're using a neti pot that you use distilled or boiled water. You do not want to use straight tap water because there's always the potential danger of introducing microscopic organisms into your system that don't belong there. Alternate breathing is also another therapy that you can try, and that would be, you can look this up online, but there's some nasal breathing exercises that you can do, and then when used in conjunction with some decongestants, this has been shown to improve or relieve the symptoms of allergic rhinitis. Aromatherapy, alternative to another alternative therapy for allergic rhinitis. Not just eucalyptus, but there's many other essential oils that you can use with a steamer to get that into the air. And basically, once you put that essential oil into the steamer, you inhale that into your lungs, which relieves a lot of the inflammation. So, for example, peppermint oil can provide relief with respiratory and digestive problems. Eucalyptus has been shown to provide respiratory relief. Lemon oil has also has antihistamine properties, relieving inflammation. Lavender oil also has natural antihistamine properties. And frankincense also has been shown to reduce skin irritations. So as we think and continue to learn more about self-care and how we can at least prepare for our allergies and lessen the symptoms that we have, there are ways that we can tell when or where we're going to be and how we may suffer based on our location. For over a decade, the Asthma and Allergy Foundation of America has created reports on the 100 most difficult places to live with allergies in both the spring and the fall season, and they put reports out every year. On this slide, I've listed the top 10 challenging places to live just to give you a glance of what's out there. You can Google these reports to find out your area and how you rank. Basically, the report uses 3 distinct indicators to determine these challenging locations. One is a pollen score. They look at grass, tree, pollen, and mold spore counts among these different regions. They also use the type of allergy medicines being purchased and used within those locations. And then lastly, they use the number of allergy doctor visits per state and location. This is how they go about ranking where those challenging places to be are. So while the timing and severity of allergy season may vary across the country, the weather and climate also play an important role in the severity and length of allergy season. So one of the things that may become important to you is that your local weather station may issue pollen alerts about spring and summer so that you can understand when it is better for you to go outside, whether you're going to have a challenging day, so that you can prepare yourself from a self-care perspective. In addition, the National Allergy Bureau also divides pollen counts into low, moderate, high, and very high levels. This includes the common allergens such as mold, grass, tree, and weed. And these levels are based entirely on ecological measurements and not health effects. So even though it's not, this is not going to tell you that you're going to go into an anaphylaxis or you're just going to have a good day, it's just really based on how it's going to impact the environment in terms of concentration. So this information will help you in terms of determining what kind of exposure you may have on a certain day so you can figure out how you want to plan your day or your week accordingly. So I want to take a moment and also talk about some helpful tips to deal with some issues with allergic rhinitis. especially if you have that perennial indoor allergic rhinitis. Now, for seasonal exposure, obviously you want to limit your exposure in the mornings because pollen levels tend to peak in the morning hours. You want to keep things pollen free in your home. So during the spring, especially during those high pollen counts that you just learned about from your local weather channel, you want to make sure you're not keeping your windows open. I don't know about any of you, but have you ever seen that layer of yellow pollen on your car when you've left your car out overnight in the driveway? That's going to get into your house if you leave your windows open and really make you susceptible to a more severe allergic reaction if pollen is in your wheelhouse for your allergies. You also might want to wear a mask when you're cleaning. Again, if you really have severe allergies to mold spores and dust within your house, this is a great way to protect yourself when you're doing that cleaning. Look at air filters in your house, making sure you're cleaning those air filters on a regular basis. They do have special air filters now for both your heating system as well as your air conditioning system that actually has a higher level for allergen protection. You want to also keep your humidity levels lower, around a 35 to 40% humidification, which also helps to reduce mold and dust mites in the house. Keeping your house clean is so important, especially for those people who suffer from indoor allergies. And I know this is easier said than done. We lead very busy lifestyles. But the thing is, if you can reduce the amount of allergens, you're going to have an improved quality of life. Maybe you're saving $1 a day so that you can afford to have a cleaning company come in once a month to really give your house that top-down approach to cleaning and really getting rid of those allergens. So research estimates today that 15 million Americans suffer food allergies. And according to the Centers for Disease Control and Prevention, food allergies are estimated to affect 4 to 6% of children and 4% of adults. Food allergens are now one of the most common allergens in babies and children, but they can appear at any age. Take, for example, my grandmother, who developed a shellfish allergy at the age of 70. Can you believe it? We had to rush her to the emergency room because her lips blew up like the size of a shrimp, and unfortunately, she can no longer enjoy her favorite shrimp cocktail. Like seasonal allergies, your body's immune system reacts to the food allergen to protect your body, and food allergens can be mild to severe. The common types of food allergies we're seeing today are milk allergies, eggs. Peanut is a huge allergy we see a lot of, especially in children. Tree nuts, soy, wheat, also known as gluten allergies, and then fish and shellfish. In fact, people with allergies to peanuts, tree nut, fish, shellfish have the greatest risk of anaphylaxis. Food allergies are just on the rise. Since 1997, food allergies have increased in children by as much as 50%. And unfortunately, there's no clear evidence of why this is happening, but researchers are investigating this to understand what is going on. So there's a difference between an allergic reaction and hypersensitivity or intolerance to food. I'm going to use the example of gluten. So today there's this big, huge fad around gluten-free diet because people are intolerant to gluten or wheat. This is a wheat allergy. But is there a true allergy to the gluten or to the wheat, or is it an intolerance? And I'll tell you, the majority of gluten allergies is really gluten hypersensitivity or intolerance. True gluten allergy is a diagnosis of celiac disease. Celiac disease comes with allergic reactions in the gut. There are very, very uncomfortable symptoms, and they actually can be life-threatening. Whereas a gluten intolerance has some of the similar gastrointestinal upset, but it does not have the life-threatening symptoms that a true celiac has. Like seasonal allergies, only a healthcare provider can determine true food allergies versus an intolerance. So again, the same holds true. You'll need a physical exam and you'll need some testing done. There's a couple of other tests besides those scratch tests and blood tests that can be done as it relates to food allergies. And those are, one could be an oral food challenge where you're actually performing using a challenge with small amounts of food that you suspect to be the allergy, and looking and watching and monitoring you for a reaction. The other thing your doctor may have you do is keep a food journal. A lot of people don't like to do this, but they can be very useful in the diagnosis of a true food allergy versus a food intolerance. And then lastly, there's the elimination diet, and that is basically eliminating certain foods from your diet and tracking over time how you feel, and then slowly introducing foods back into your diet to see if those reactions are quote, allergic reactions come back as you reintroduce those foods back into your diet. Most food-related symptoms happen within 2 hours of ingestion, and they often, or most of the time, they can start within minutes. And those of you who suffer from peanut allergy know that this can be a quite volatile food reaction. In fact, if you've ever been on a plane and you are riding with someone who has a severe peanut allergy, they will actually not even serve the peanuts on the plane. One time I was on a plane and someone had a peanut allergy and they didn't announce it or tell one of the stewardesses, and someone actually opened their peanut bag, and just by opening it, the peanut spores got out of the bag and caused a severe allergic reaction on the plane. It was a little scary, to say the least. Delayed reactions are commonly seen in children, and generally this comes about as a result of eczema. So children may actually have eczema as a relation to food allergies. The scariest part about food allergies, especially if you're older and you've never had a food reaction before, is that you don't know you have them until you have that first one. Now, some of those mild reactions will be some skin irritation, maybe some itchiness around the mouth, tingling perhaps on the tongue, maybe some gastrointestinal upset, a cough, or an odd taste in your mouth. Now, these severe reactions, as you can see, could be shortness of breath, wheezing, chest pain. This is when you need to call for help or call 911. This is serious and can translate into an anaphylaxis response, and you could die. I don't want to scare anybody with this slide, but this is what can happen. Food allergy is probably one of the most common causes of anaphylaxis, followed by insect bites, medication, and latex allergies. So you've got to be prepared. If you know that you have a severe allergic reaction to the foods you eat or to insect bites, I really encourage you to get a medical alert bracelet or a necklace, something that identifies you, so that if you're in a social setting where people may not know you and you happen to have a bee sting or some type of reaction to an allergen, someone can help you because you have the medical alert bracelet. Now, as many of you know who do suffer from allergens and have severe reactions, epinephrine is a medication that's used to reverse the severe symptoms of anaphylaxis. It is highly effective, but it must be administered promptly. In fact, it has to occur within the first 30 minutes of the reaction. Most people who have severe allergies are prescribed an EpiPen so that they can self-administer their epinephrine generally in the outer thigh. If you have an allergic reaction, remember to be vigilant. Make sure you identify yourself again through a medical alert bracelet or a necklace. Always have a treatment plan. And if something does happen, do not hesitate to call 911. anaphylaxis can cause death. Okay, so the best way to avoid those food allergies, of course, is avoidance, but we can't avoid everything. But understanding and knowing your allergies is the most important thing that you can do for your own personal self-care. As we've mentioned, there are over-the-counter medications. You need to work with your physician to understand what would work and what is best for you. There are some alternative therapies as well that are available. Acupuncture and herbal remedies are available. However, I do want to caution you that there's not a lot of research around these, and food allergies are very, very serious. There's a study published in about 2000, I believe, where 95% of people who were treated with an herbal Chinese remedy for a specific allergy saw improvement. But again, this does not mean that this is a primary self-care remedy. It is important to work with your physician and understand how you can work together to create a food treatment plan that's going to work for you. So food allergies can be difficult to deal with. Sometimes we feel like we're having our most favorite things taken away from us and we feel bad. The thing that you want to do is focus on the positive. Instead of focusing on what you can't have, focus on the foods that you love to eat and that you can have. Make sure that your friends know about some of your food allergies so that when you're in social situations, you don't feel deprived or you can't eat what everybody's having, and then you feel miserable in that setting. Keep things simple. Make planning for your foods easy. A protein, a carb, that's all you really need, and some produce, some nice vegetables. Keeping things simple keeps costs down and makes things less stressful for you after a long work day. And lastly, make sure that you have some type of allergy relief kit, and that could include that EpiPen we just talked about. But you've got to have a home kit, a work kit, and maybe even a car kit to keep you healthy so that you're making sure you're living optimally with the allergies that you have. We all know that being sick can be costly. And thankfully, from a healthcare perspective, we can do lots and lots of things to prevent a lot of our diseases that cost a lot of money. Unfortunately, allergy sufferers have little control over their reaction to those allergens. For those of you who have mild allergy, good for you, you're not spending a lot. But for those of us who have moderate to severe allergies, you're probably spending quite a bit of money on allergy medications or over the counter. In fact, the average over-the-counter drug costs about $12, and while that may not be a lot, if you're using quite a bit of that, it can add up over time. Prescription medication is out of control. It's an $11 billion industry. Doctor's visits are rattling in the $1.3 billion in doctor fees per year. And average lost days from work are about 2 days. You just can't afford that. So the good news here is that as long as you can improve your understanding and your awareness of your specific allergy, you can lessen the severity of your symptoms and control some of the costs associated with your allergies. So there's an app for that. Nowadays, there's an app for just about anything. Thank goodness, right? So there's a number of apps available today for allergies, believe it or not. And if you did a quick Google search, you could find something for your mobile phone, whether it be a smartphone, an iPhone, or even a BlackBerry. I get teased a lot. I still am one of those people who love my BlackBerry. A few here that I'm just going to point out. Allergy Alert, for one, provides accurate forecasting for a variety of environmental allergies, which can be invaluable in planning outdoor excursions or a day in the park. They provide a day-to-day or a 4-day forecast. You can set your location. It also includes health indices for asthma, as well as UV radiation and cough and cold risks. So that's pretty cool. The next one is offered by Zyrtec, and by the way, the Allergy Alert is a free app. The Zyrtec Allergy Cast is also a free app. Again, it provides the ability to forecast pollen counts and pollen levels. It will provide you with the most prevalent levels and tips on how to avoid pollen in your area. You can set it for locations for a quick reference. So if you know you're going on vacation, you can set it for your current location and your vacation location. And this is a great way to be proactive so that you can prepare for your vacation if you suffer from allergic rhinitis. So these are some of our resources that are available, and for those of you who have not gotten these through your employer, if you'd like to contact us at support@simplicityhealthplans.com, we'd be more than happy to provide you with these free resources on alternate nasal breathing for allergy relief, as well as how to create your own allergy relief kit. And remember that allergy relief kit can be used at home, in the office, and even in your car, so you're always prepared for those allergic responses. So I want to thank you for attending today. I hope that you were able to take some information that's new or build upon what you already know. Spring ahead, and I hope that you have a refreshed outlook on dealing with seasonal allergies. Thank you, and have a great day.